question is about NCCI Edits or CCI Edits. The question is, I wanted to know if someone can clarify some confusion I have about when multiple surgeries are done on a patient, but the codes the physician is using conflict with each other because of CCI Edits. How is the procedures billed if CCI Edits say that the CPTs cannot be billed together? So in answering this question, I just assumed that you already knew that we have 2 or 3 columns when you're looking at the edits, depending on what format you're looking at the edits in, so that you know where your comprehensive codes are and then the ones that are included. And then we have a column in which we're going to have some little indicators on edit beside it. So the short answer to your question is you would be able to bill them with a modifier. Now that's the short answer. It may not always be the right answer. The CCI will have either a 0, a 1, or a 9 beside the edit in that column. If it is a 1, then a modifier is allowed to override your edit, and both procedures can be billed together, or multiple procedures depending on. Now here's the long answer. First, we have to understand what the 0, the 1, and the 9 mean in the edits. 0 means there's no way any payer is ever going to pay for that combination or column of codes. Nothing you do or add is going to change that. It's flat out never going to get paid. So you can't bill it together. 1 means that you can add a modifier to your column 2 code if it meets that criteria for unbundling, such as separate lesion or separate site or separate incision or separate session. You good, Alicia?
Mm-hmm.
9 means that it's mutually exclusive. That means those 2 codes would always be a part of the procedure, so it can't be billed. It's, you know, it just goes hand in hand. And once again, there's nothing you can do about that. No modifier is going to help you out. If the procedures your physicians are billing have an edit of 1 in the column, then review the documentation. A lot of times physicians just don't know that codes will bundle together. And I put a little example in here. I had a surgeon one time who had a little cheat sheet that his staff had made, and he was using it to submit charges to us on it. And he'd have like 6 codes circled. And when we put them in, we'd get edits on 4 of them. So finally I had to ask him about it because they all got an edit of 1, so I could have added a modifier to get them paid. And when I questioned him about it, he goes, oh, I was just circling it so you'd know how to bill it. He had no clue that what those codes meant because nobody gave him the full description of those codes.
Unbelievable.
So, you know, that's, and what's so bad is he did this for 3 years.
And that,
and
you know, he's not the only one.
I was like, you've got to be doing anyway.
Men never ask for directions. You should know that.
I know. Well, he thought, you know, he thought he was helping us out. He said he circled everything he did because all he got was like 1-word descriptions on there. He didn't realize it was all 1 code. But anyway, when you are reviewing your documentation, or when I review documentation, look at the CPT's description of separate procedure that's found in the surgery guidelines. You want to know, you know, what that separate procedure is going to be. So it's going to be a different session. It's going to be a different procedure or surgery or a different site or organ system, separate incision or excision, separate lesion, or a separate injury. You also have to know your carrier's guidelines on some of these. Billing rotator cuffs for Medicare. Medicare thinks that a shoulder joint is all 1 joint, and they don't pay for the separate compartments that you may be doing something in. Whereas another insurance carrier, even though those codes would edit out, you could, you know, put that modifier on there and get both paid. So you want to make sure you know your carriers very well too. Just a quick example. Oh, I guess I had 2. I was on a roll when I did this one. removal of a 1 centimeter benign skin lesion on the right arm and a skin biopsy on the left arm. Code 11100 is a column 2 code when it's paired with 11401. But it does have an edit of 1. Because the biopsy was on a different site, we could bill with a modifier, so it would be 11401. And then 1100, XS is what I would use. Some people use XU. Some of you may still be using 59. I don't know how that's working for you, but anyway, still exist. We're not allowed to use them anymore, but anyway. Left heart cath. Left heart cath. I was disappointed that this became a bundling issue this year. Left heart cath 93458. If we place a stent 92928, those two codes are going to edit out. 93458 is a column 2 code. It does have an edit of 1. So in this case, I would build the 93458 with an XU or a MOP 59, and then the 92928 with the RC for the stent placed in the right coronary. Documentation is the key to this. It isn't just enough to say they did it, but you need to know why they did it. A lot of physicians will say, yeah, I did it, just stick a 59 on there and get it paid. That's a no-no. Very big no-no. It has to be done for a distinct reason on there. So just review their documentation, and depending on which edit you can do, you can get them paid.
Fantastic.
Okay,
Again, that's not only knowing the coding, but it's very important to know that billing aspect as well, and that's definitely shows how important it is.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.